Thank you. First of all, I'll acknowledge the member for Nungara's motion here and obviously can speak volumes to it. In particular, the fact that it, in clause D1, where it mentions the Keith District Hospital. Obviously, I'm no stranger to this area for batting for local health hospitals and networks and obviously services for our regions. Also, I just acknowledge the member for Dunstan and her amendment, even though it's not the same as what's been advocated here by the member for Narungga, it's still a motion that supports regional health and the network that he's got here, and it basically implores the state government to do all they can. And I'll speak to both of them because the Keith Hospital wouldn't be the Keith Hospital if it didn't have the state government support by the Liberal government or the Labor government. And I'm going to mention a name here that's front and foremost when the Keith Hospitals talks about is a lady called Ms Kelly Borlase, who's now on the Limestone Coast Health Network board. But she was the coordinator of the model that the Keith Hospital now exists and is using. And I was there just recently at the Keith Hospital for a dear lady that's obviously it's an aged care facility as well, who turned over 100 years old, and we went and celebrated her birthday. And called in, and the hospital and the precinct with the aged care was just amazing. And not only that, but the way that the Director of Nursing, who I know quite well, Miss Jackie Halliday, known her for a long time, and known her husband, Richard, for a long time, is a merino sheep breeder, locals running this community hospital from where we were when I first came to politics in 2018, from a private hospital model, had bled a lot of funds out of the community. I believe in the vicinity of $1.2 million worth of community funds keeping the Keith Hospital alive in meeting the needs of the community. And in the end, it fell over because of its private hospital status. Can we just speak volumes to the local health network now? That was also the old health network back in the Limestone Coast under the previous chair, previous CEO, to the new ones that are in their places now, to where the Keith Hospital has landed, advocating the fact that it has a nurse practitioner, it has backed up by paramedics, and this is the thing that Keith really did struggle with. I think it's got at least 2 or 3 doctors coming from at least border town, backing up that Keith Hospital model, which it was wanted, it was warranted, but we never knew where it was going to land and how it was going to work. And it's my understanding that the relationship between the doctors now and the Keith Hospital and its model is a really good model that's working well for the region, not only the region, but for the township of Keith. Overall, just as everyone here has been speaking to this motion by the member from Narungga in advocating for regional health, never have we seen sort of such dynamics in health and difficulty around the shortage of doctors, the shortage of services, and such pressure being put on the medical system statewide. One of the things I think is going to be highlighted, and there'll be no hiding from this, and there'll be no government that will be, whether they're Labor or Liberal, it won't matter, is that the health system has to take a long, hard look at itself. And I'm not talking about the soldiers, be it the nurses, I'm not talking about the doctors, be it the GPs or even the specialists, but those that manage the health system, so that the tier above this has to have a long, hard look at itself to say, are they worthy of their job? Are they doing a job that's needed? And are they in the way of good health services for this state? And I can tell you it's going to be found and it's going to be seen if this is not the case. And it starts off from the fact that we know that we've got a new Royal Adelaide Hospital, and we know before this new Malinauskas government's a new Women's and Children's Hospital being proposed. And if we go back and see what the new Women's and Children's Hospital, so the new RA Hospital has cost, and it's per square metre costings compared to a private hospital that was built in Adelaide, and they'll say, oh, but the RA is a lot bigger and better and grander, and that was why it was so much more expensive. But the point that I'm going to make here is the more money we waste, the more money we say that we need this and it's going to be the most expensive build and it's going to be the best women's and children's hospital, the more money we don't have for our regions. And the more that these problems like the Ardrossan Hospital and all the Keith Hospitals and all the other networks have to suffer because of the drain on the system by those that are up above spending more than what they should, more than what a private sector would, and not just by a little way, by 2 and 3 times more than the private sector would, then the public service and the health system has to take a long, good look, hard look at itself. Because the people will revolt, and they will highlight, and it will be pointed out what's going on, and there won't be anywhere to hide. And if you are in these jobs where you could say it's more like jobs for the boys, or it's bureaucracy, building on bureaucracy, and it just falls over and implodes, well, if that's where you're inevitably going to land and you don't mind that, that's all right, we'll stand back and watch. But I tell you, when you turn and you go down to a sort of collapse, and you look at where the Victorian government now lands itself, and it can't even complete its projects, it had to turn down a major sporting event because it's run out of money, then this pot does actually run out. And people are going to have to start saying, well, you know, we're going out to $44 billion worth of debt in this state, and we can't keep our people alive and we can't keep them in health services. Oh, sorry, we just ran out of money. Well, that isn't acceptable. And so I obviously understand the struggles we're seeing there in Narungga. We understand the struggles that this community hospital is now found itself without any foundations. It's found itself without any support. I imagine the budget for the local health network around the Ardrossan Hospital probably doesn't fit, and then all of a sudden, well, it's like it's too bad. We've just got to close the doors, and people have just got to travel 40, 50, 100 k's to see the next health system or health network or whatever it is, or facility. And all I would then say is, if that's the inference, and the inference is that we'll just transport all our regional community into a city-centric hospital system that's probably and should be and could be Rolls-Royce in grand in its entirety. It does not mean that the tentacles out into the regions need to be rusted, worn out, tired, as we heard from the member for Flinders, where kitchens don't work, where bathrooms are not suitable for all patients, whether it be at disability or elderly. And then you say, well, how do we then live and how do we then cope? And but there's not enough money to go around. And then that's all right, we're spending it on this new women's and children's, and we spend it on the RAR, and we spend it around Adelaide, and then we'll just fly the flying doctor up. And here's an interesting statistic I just heard recently, because I'm seriously looking in this area. Apparently in the early 2000s, there used to be around 30 Royal Flying Doctor visits into Mount Gambier, I think per year. And now there's up over 700. Well, those 700 now just happily fly down to Mount Gambier, pick up what they can't do in Mount Gambier now in the way of services, fly them back to the Royal Adelaide or another hospital that's in the city, and just add to your problems in the city. And then the government here suffers from ramping. Well, you're not getting a good solution here, I can tell you. You've just got 670 more visits from Mount Gambier because the services that are down there aren't meeting the needs of the people. So we just load it up here in Adelaide, and then we wonder why the ambulances are stuck on their ramps. So all I'm really going to say here is that I really do thank the state government, be it the previous Marshall government, but now the new Malinauskas government, the new Minister for Health, in regards to the Keith model. I think there's probably, in my own electorate, we could probably see the Keith model roll out to other hospitals in its services if those hospitals continue to lose more hospital services that we see there at the moment. E.g., Keith Hospital doesn't have a hospital bed anymore. But look, it's better than having the doors closed, and I can tell you they've got doctors there now, and they can go 40 k's away to Bordertown, so that's a tick, that the community will wear that. We know that the model is more efficient and effective in the fact of having this nurse practitioner. Problem is, nurse practitioners are really hard to find. We know we have a beautiful nurse practitioner operating out of Pinaroo, absolutely loaded. Not only is she seeing South Australian residents, Pinaroo, Lameroo, she's seeing Victorian residents come across the border to go to Pinaroo and work with her. And also even the service sector around health and the specialists are also coming in Victoria to back up a nurse practitioner at Pinaroo. And maybe this will, what the Keith Hospital also see eventually happen, we'll see some more specialists going to Keith, because it's being backed up by the local GPs, backed up by a nurse practitioner and other nurses with an aged care facility. All I can say is I speak volumes for it. I thank the Limestone Coast Health Network for the Keith Hospital model. I hope that model is able to be rolled out elsewhere rather than closing the doors on our health facilities. I wish the member for Narungga all the best with his advocacy for Ardrossan, and long may we all have good health in the regions.
The member for Finniss.